Disease prevention has certainly taken center stage over the last 2 years, and APHA'S Alliance for Disease Prevention and Response is working to prioritize the lessons learned from the pandemic. Angie McGowan, Senior Director for the Alliance, joins us here in studio this morning to discuss a little bit more. Thanks for your time today.
Sure, thanks for having me.
So let's talk a little bit about what APHA'S Alliance for Disease Prevention and Response is.
So the Alliance is a cross-sectoral group we brought together at the start of the pandemic. I'm realizing that it was really important to talk to all different sectors, all different types of organizations to figure out how we get through the pandemic. But we really wanted to make sure that this was a long-term effort. And so you notice we don't mention the pandemic in our name. And so we're trying to figure out both how we move past some of these things we dealt with over the last couple of years, as well as to make sure that we really get to the resilient, equitable public health system that we need going forward.
So after speaking with some of these groups, kind of going through that information gathering phase, what are some of the initiatives that the Alliance has been involved in over the last couple of years?
So the first thing we thought was we needed a place for people to come together, share, talk, connect. And so we've had monthly meetings on topics from vaccine equity to working with communities to going back to school to figure out how people are learning from healthcare, education, public health are all important to work together. One thing we heard, though, is that we really needed to think about how to collaborate and align efforts, and that people couldn't find the resources they need. And so with colleagues from the Institute for People, Places, and Possibility, we've created what we're calling FERN, or our Public Health and Equity Resource Navigator. So it's a place where you can find resources looking at different sectors, where we hope it's a two-way street. We don't want to own the documents, we really want to amplify what's already out there. And so it's an example of how we try to make sure people can connect. And recently we've really started to finally transition to looking at where we need to go as a public health system, not just as APHA, but as this collective group of 80 organizations or so, to think about what we've learned around the pandemic, the recommendations for going forward for a public health system, and to come up with a smaller set of things that we together can put forward as good steps for how we'll move forward with the public health system, making sure that we really center it on equity and lift up communities and bring in some of those great multi-sectoral collaborations that have happened over the last couple of years.
It really seems like with regard to disease prevention, with the pandemic, it seems like we still have a lot of challenges that we face. Do you agree? And if so, what are some of those?
I do. I think one of the big things we've seen has just really been the challenges to both public health itself, as well as to a lot of the people that work in the field. We've seen everything from, as everyone knows, public health officials who've been villainized for doing the work they do. We've seen some lack of trust with what we're doing. Over half the states have passed legislation that actually restricts the ability of public health officials or government officials to act as needed in something like a pandemic. These laws passed, I think, based on the pandemic, people being upset about not wearing, having to wear a mask or getting vaccinated. But a lot of the implications are really long-term for how we would react to other things like a flood or other public health emergencies. And so we're really fortunate that we're working with some really great partners, Local Solutions Support Center, Act for Public Health, which is a group of public health law organizations, American Heart Association, and others, to figure out how we can come together and provide resources to states dealing with these challenges.
So it sounds like one of the things that we learned from the pandemic is how desperately needed collaboration is across the board. All right, it is a very exciting week here at APHA 2022. What are some of the activities that you're looking forward to taking part in?
So I'm really excited that a couple of things we just talked about we'll be able to really lift up over the next couple of days. So on Monday, we're going to have a session about these challenges to public health authority. We also, the next day, have something we're excited about, which is really a brainstorming session to think about how we can, if people are ready to act, to think about how they can speak up for public health, how we can learn how to communicate about it, to do messaging, to think about how you could figure out what the laws are. So we hope it's really interactive, and we hope people will join us. And then we'll have a session Tuesday morning on the Alliance, just talking about what we do and also telling people about FERN. And finally, we have 2 booths, so hopefully people will come visit us both at the Alliance booth as well as one for FERN in APHA Central.
Wonderful. Lots to look forward to. Well, thank you so much for your time today. We appreciate it.
Thank you.